When I was pregnant with my daughter, I earned too much to qualify for Medicaid. I worked full-time, but my employer's health insurance options were too costly.
I was not on Medicaid with my first child. We still had insurance through my employer. It was with my second child during COVID that I had lost my insurance through my work. I was pregnant. I was terrified. I was concerned how I was going to have a healthy pregnancy.
But Medicaid changed everything for us. I was able to take care of her and take her to her well visits. She got her vaccines on time. I didn't have to be afraid about how much it would cost me to take her to the emergency room if she got sick. All this care would have been out of reach, but for Medicaid.
Medicaid has been a lifesaver for my children and myself. My youngest son is severely autistic and nonverbal. Without Medicaid, he would not be able to get the early intervention therapies he needs. Therapy that's helping him learn sign language and to speak so he can communicate.
Too often, policymakers assume that people on Medicaid can just pull themselves up by their bootstraps. But some people's needs are just too great. And then there are people like me who just needed a hand up for a short time. But for Medicaid, I would have had to make impossible choices.
Right now, I'm making do using programs such as SNAP and WIC to make ends meet. I'm able to work about 15 to 20 hours a week doing DoorDash. I can't work full-time and get my son to all his medical appointments. I'm my child's best caregiver, and he needs me. Any parent could find themselves out of work because their child needs them.
Medicaid isn't just a safety net, it's a lifeline, especially for children and pregnant moms.
But for Medicaid, my severely autistic son wouldn't have a chance.
We have to protect Medicaid for children, for families, for people with disabilities, and seniors.
Every child deserves access to health care.
Protect Medicaid.
Protect Medicaid.